I'm Dr. Koh Hau Tek. I'm currently the Deputy Chief Medical Officer for Jiahui Health, which is based out of Shanghai. We have a 500-bed international hospital with two medical centers, and one of those medical centers has a day surgery unit and endoscopy suites. We also have a wellness center in Shanghai, and we have partners in Hong Kong and in Shenzhen as well. My role in Jiahui Health is very much, leading basically the team of physicians, which are both international and local in China.
So tell me a bit about some of your vision and your goals for your organization and what you hope to achieve.
Yeah, with Jiahui Health, we look at three things: care, quality, and impact. So care in terms of clinical outcomes is very important for us, and quality in terms of operational processes need to be top-notch for efficiencies, and of course in terms of financial management. And in terms of impacts, it will be impact on the business. That's what we do. And of course with the overall strategy of building not just a hospital but a network of medical centers to support a third-party administrator system and also insurance model at the end of the day.
Fantastic. So tell me a bit more about the steps you're taking to achieve all of that.
Well, I think the first part is when the hospital has been built. The hospital is built fully built 2 years ago. The planning has been since about 10 years back from now. And what has happened is like a couple of medical centers were built before the hospital was fully operational. And now, over the last 2 years, Jiahui Hospital is fully operational. And as we move along, we want to build more medical centers and possibly more hospitals. But we still hold an approach that we want to leverage on technology, in order to be able to link in all our different points, such that we can provide seamless care to patients throughout Shanghai and beyond.
Can you tell me a bit more about your vision for using technology and what you hope to achieve from using technology?
Yeah, with Jiahui Health, what we look at is not just the B2B segments. We are looking at B2C as well, directly to patients who are looking for cost-effective care in the private sector in China. So technology comes in a big way, especially with e-commerce in China. It's huge. Those who have been in China will, I hardly bring around my wallets. In China we have that there is no need for physical cash. That's of course just one aspect of many others in which technology has changed the society in China as a whole. So we provide services using such technologies, some of which we develop ourselves in Jiahui Health and some of which is outsourced, to reach out to potential patients that can seek cost-effective care with us. In terms of marketing purposes as well, we do use technology to reach out to individual patients and to come to us, and we know that our pricing is very, very competitive in the private sector.
So what is some advice or tips that you would perhaps, or maybe key takeaways for other healthcare leaders in China?
I think China is a very different market. It is a huge market. It is slightly China is a huge market, and there's regulations which are quite local, and I think those are the kind of challenges that one needs to have, and one needs to have that kind of sense of it before, say, entering a Chinese market. For senior leaders that are looking at the healthcare market in China, regulations is definitely one of those risks, if one might say, that needs to be mitigated. After which will be like for the financial risk, the clinical outcomes kind of risk that needs to be mitigated as well. So for senior leaders who are looking at this huge market, potentially huge addressable market, certainly it holds a lot of promise, a lot of opportunities. Shanghai alone is already 24 million people, and that's one of the largest, if not the largest, global city, around the world. So that itself, with the willingness to pay off the regular population for a higher level of healthcare that is above what they can get, say, in the public hospitals, I think we see a huge market for senior leaders who are in healthcare.
You mentioned a bit about what was it? I mean, it's a large city, and healthcare access is a problem for any kind of large city. I know this is not in the questions, but I was wondering how do you address that kind of access to healthcare? Is technology helping that?
Yeah, well, the healthcare has moved from offline to online as well in China. So for us, we have basically a series of a network of medical centers and of course one hospital. But we can also be using the online channels at which we provide good access to healthcare for our patients through teleconsultations, which happens, and the logistics supply or logistics network for medication is very easy in China. The last mile in terms of logistics is very clear and very I would say mature. In being able to deliver the medication, for example, or equipment or devices that the patients need at home to their offices or to home very easily. So with teleconsults and with logistics delivery, we complete a good kind of primary care system that Jiahui has been able to fulfill. Of course, moving forth in terms of operations, surgical operations, those that require procedures, that will take a little bit more time. But with 5G coming in, and China is on the front and leading edge in 5G, there have been operations already done between Beijing and Hainan Island, 3,000 kilometers away, real time, in the public hospitals of China. And I do not see why in the private sector that we cannot do that as well. We can be operating on a patient somewhere in the inland part of China or outside of China even, operating from Jiahui Hospital.
It's interesting that you mentioned 5G and real time. Can you tell me a bit more about the healthcare landscape in China right now? It sounds very advanced compared to even Singapore.
The public hospital system in China is going through a lot of reforms by the Chinese government. They want to do better, and we hope that the Chinese government is able to improve the healthcare system even more. They are already getting there, and in fact, what I see in terms of the public hospitals in China leveraging on technology, it is already beyond some of the private sector hospitals. So in that sense, some of the patients in the public patients, they are going more and more into the public sector. However, there's also a segment that does come into the private sector too. One, because their paying power is a little bit higher, they want to experience better service quality, and of course, some of which are also related to higher patient satisfaction. So the healthcare system in China is improving. Like for us, we are coming in as part of the overall healthcare system of China and forming a private ecosystem for healthcare. And we hope that we not just hope, we will aim to be able to transform the private healthcare ecosystem, especially in Shanghai, if not China.
So speaking about transformation and these kinds of new technologies, what would you like to develop in perhaps the next 12 months to improve services, to bring in like all the teleconsultation and so on into your network?
I think the network, I think number one is the electronic medical records, a very basic, a fundamental operational aspect of running a hospital and healthcare system is to be integrated between the different locations that we are working. For example, a patient that come into one of the medical centers, which is about 40 minutes drive away from the hospital, a few months later, if he or she attends the hospital, we can still see those medical records easily in the system. That's one. And number two is being able to expand this to also network panels, network providers, which can be outside of Jiahui system. It can be even a public hospital system. And once they are on board the network, which we have already made quite a few collaborations with, this network will expand, not just in Shanghai, but in many other cities in China as well. And for them, we make sure that in terms of clinical governance, that they are good, that they satisfy our level of clinical and service quality. And then the patients can be referred inwards towards the main hospital if they so require, for us to have tertiary care with us. And we can also help them should there be any very complicated cases, say outside of Shanghai, for them to attend another hospital that is on our panel. The use of technology will transform healthcare in China in a very, very big way, and we are already starting to see that. From 5G technology being one of the key components of real-time live surgery across borders, across physical distances, is something that we are looking at as well. It's just that we do need a little bit of time, being a fairly young hospital of only 2 years since we started operations, that we require time to build that kind of patient load up to have enough for us to do major surgeries online.
So I just have a last question. Here at Hospital Management Asia, what do you hope to achieve by coming to this event?
I've been invited as a speaker, and I felt that this is a good platform for those in hospital management to understand what is happening around the region in Asia, in terms of from operations to talent management, which I have particular interest in, to using technology to improve operational efficiencies and safety for patient care. I think these are good topics which all hospital managers should really want to come and have a look and see what other hospitals are doing, and what they are looking ahead in the future as well, what they would like to do. So with this exposure and this platform, this exposure, it helps me as someone in a management role in Jiahui Health to look beyond China and to see, because over here there are not many from China organizations at this particular event. But I understand that HMA is moving into China as well towards the end of this year, and going to have one in Guangzhou. So I hope to also contribute as well over in HMA in Guangzhou. Of course, everything will be in Chinese and in Mandarin, but that is how China works. Yeah.